Welcome, everyone. We are so excited today to partner with Fighting Blindness. We have Michelle, Katie, and myself, Melissa Matthews, and we are just so excited to learn and grow together in the amazing resources that both of our organizations have to offer all of you. This morning or this afternoon session, APH ConnectCenter will start off, and then we will shift it to Fighting Blindness with Michelle, and then leave the last little bit for Q&A. So we're going to go ahead and start off, and if you have any questions at any point, feel free to put those into the chat, and we will moderate those as they come in. So the ConnectCenter is from APH, and our mission then is to empower people toward greater independence, lifelong success by promoting curated information and resources to assist children, parents, job seekers, adults, and older people who are blind or visually impaired. And the APH ConnectCenter is a wealth of resources. On our website, we have lots of great resources, ways to connect to help you and the people that you care about. We have all sorts of webinars, just like the one that we are having today. And we also have the Directory of Service, which is a space that you will hear more about, but it is an entire wealth of knowledge for every state, whether there's local resources or national resources that you have access to. And on the next slide, you see we are in the process of updating and redoing our website. So this is the current website and the ConnectCenter, and we have a photo of Alan at his desk. And basically, when you come to this site, you will find across the top everything for ConnectCenter VisionAware, which Katie runs. She'll tell more about that. Family Connect, which is the site I run, and I'll tell more about that, and the CareerConnect, as well as our webinars and coding symposium. And Katie, interrupt me at any point if I happen to miss something.
Sure.
Thank you. On the next slide, we see the APH Directory of Services. So this is, as I mentioned, you can search by category, you can search by state, and anything and everything that you would find valuable or as a resource, a space, a way to connect and learn more, you will find it here. So one of the great things is that if you do know something that's local and it's not on our directory of service, you can absolutely have it added to our directory of services. But there are over 2,000 profiles of agencies that are serving people who are blind or visually impaired that are listed in our directory of service. It is a wealth of knowledge. On the next slide, we talk a little bit about our ConnectCenter webinars, which, as mentioned, we've got stuff for families and parents. We've got stuff for the transition age youth, as well as students entering college and young adults and adults in the workforce and career space, as well as older adults that may be new to vision loss, but need that support as well. So you will find an entire wealth of ConnectCenter webinars on our webinar page, but after they are done, the recordings live on our YouTube channel. So if you've missed a great session, you are welcome to go back and view that, or sometimes there's so much information you need to rewatch it. So the ConnectCenter webinars is a great place to find lots of information that's up to date and current.
I believe we have over 100 webinars on our YouTube channel, so we'll have a link to that here coming up, but our YouTube channel is a great resource for finding those webinars and watching them again. Some really good content up there from all of our sites, from families to for job seekers and for adults.
Absolutely. And the next slide, we have our Connect calendar. This is where if you have a local event or a state event that you would like to list, you're more than welcome to, as well as an opportunity to see what is going on in your area or in your state. The next slide talks about the APH ConnectCenter Contacts. So this is, I think, honestly, one of, and I'm not knocking anything that I do or Katie or Richard or Lori, but I think this is one of the most valuable resources is our informational and referral line. So that phone number is 1-800-232 5463. And this is where if you call, you actually get a live person, Alan, who was on the photo earlier, or Sharon, who will answer the phone call. They give an entire wealth of knowledge, resources that are local to your area. And if they can't figure it out or they're unsure, they have a team behind them that they reach out to as well. And we all work together to be able to help support anyone who is calling. You will also find our email, connectcenter@aph.org, and ways that you can connect with us socially on Family Connect's Facebook, CC for job seekers, and VisionAware, and Twitter. We also have, as Katie mentioned, a wealth of knowledge on our YouTube channel. And I will also give a plug. We are also on Pinterest and Instagram, as well as an entire APH. So some of our stuff gets sprinkled throughout those other sites as well.
And Melissa, just a few more on that. Is our information line is open Monday through Friday from 8 a.m. to 8 p.m. Eastern time. And again, you will talk to a real live person. Alan and Sharon are both individuals who are blind, so they get it, right? They've had that firsthand experience that I too have had as well. I'm blind also, but so you're getting, again, people that really, understand what you might be going through or what questions you have or what you need assistance with. We're also, as of this week, on the Be My Eyes platform. So that is a service that is available on smartphones. You can connect to the ConnectCenter through the specialized help section of the Be My Eyes app and reach out to our information and referral line specialists that way as well. So we are always looking for new ways to expand our reach, and we think that this partnership with Be My Eyes is a great organization. For those who don't know what that app is, it connects sighted volunteers to help people who are blind or low vision accomplish some tasks. But we have joined them on the specialized help section. So if you reach out to the information referral line through Be My Eyes, we can't provide sighted assistance for you, but we can help with your blindness or low vision questions. So, throw that in there.
Okay, so the next page that we have is all Katie's. It is VisionAware.
Yes, so thank you. And VisionAware is our site in the ConnectCenter family that focuses on the needs of professionals and adults and people who are maybe older. So we have on the homepage, we have our different sections on the page. So we have about, which tells who we are and what we offer. We have our everyday living section, which has tips and resources for dealing with blindness and low vision. Working life, which has some resources for people who might be seeking employment. We have the Your Eye Condition section, which has a glossary of definitions about some common eye conditions. We have a glossary of those, and then we have articles about those topics as well. So you can find information about retinitis pigmentosa or diabetic retinopathy, for example. We have our for seniors section and our emotional support section, which offer again resources for finding support groups and resources in your area. And we also have links to the other ConnectCenter sites and our directory of services.
Okay, on the next slide, Katie, you kind of went over everything that was on the VisionAware.
I did. I'm just trying to get back. There we go. All right. Sorry about that. All right. So also on our VisionAware homepage, we have our finding help after the diagnosis, which is where if you've just been diagnosed as someone who's blind or low vision, what's next? Where can I go? How do I what is a low vision exam? How do I get one? We have tips for living with vision loss. We have our helpful products and technology, which is something that we are updating. And we have our VisionAware blogs. And our blogs are personal stories written by a group of volunteer advisors that we have. And they have, really stepped up, shared their experiences with us. It's that personal connection. So check out the blogs. We will talk more about those on the next slide here. A couple of our resources that we want to highlight. We have a getting started guide for people who have maybe, again, just recently had a vision change or are adjusting to blindness. We have our getting started guide, which has some helpful tips and resources for modifying your home, using different lighting, different contrasts, things in your kitchen. It's a great guide. It's available in English and Spanish on our website as a PDF document. We can also mail you a hard copy if you prefer in print. And parts of the information guide, of the Getting Started guide, are available on our information line. If you call that 800 number, you can listen to parts of the guide on the phone. So that's another great way. We have our information for professionals who are working with people who are blind or low vision. That is a new section of the site that we are looking at, again, adding more content as we go along, but there are some great resources in there for talking about working with people who are older. How do you provide human guide? What is the best way to work with someone who is blind or low vision? We have also our support groups, which are, again, a free resource for finding support groups in your area, or support groups that may meet on Zoom, and people can reach out and find support wherever they are. Just, again, making that personal connection for people who might be adjusting to blindness or low vision. We have our diabetes guides with lessons in both English and Spanish on the website as well, which are, again, a wealth of information.
Okay.
And Melissa, Family Connect.
The next slide is Family Connect. So this is the website that I help contribute and manage. You will find all sorts of information for education after the diagnoses, multiple disabilities, browsing by age, and within that, there's lots of information, babies and toddlers through middle school, those transition ages, and again, the education piece. I know not a lot of you were on, but we were talking just briefly before about education and having equipped information with what the laws are and everything that you may need when you sit at those IEP tables and other meetings representing your child when they're younger and involving them when they do get to that transition age. On the next page, this continues our website, our homepage. So again, you'll find some great tips when you're working with medical professionals and some fill-in format kind of documents that you can take your notes. I know as a parent, a lot of times I would forget things, but having something that you can jot down your notes with from medical professionals is a huge help. And then again, one of the big things that we've worked really hard to build up are blogs that are written from parents. This provides that space to share their stories, as well as just another way to connect and hear everyone else's stories. We are also working really hard on beefing up our ability to provide information in Spanish. We know that about 28 to 30% of the consumers who come to our site are needing Spanish translation and interpretation. So that's something that we're excited to continue to work on. On the next page, I kind of went over this, but one of the big things that I do want to share is that we have the Parent Connect group, which is the first Wednesday of every month. And we've partnered with Chicago Lighthouse, and we just have an open space for parents to come and share great successes, concerns, upsetting things. It's not recorded, but it's a space where you can be heard and you can be around other parents virtually that are going through similar situations. So that is something that I look forward to every Wednesday, learning from other parents and being able to connect. As I mentioned, you'll find lots of blogs and articles, as well as videos and personal stories from families on our website. The next slide is APH ConnectCenter. And Katie, do you want to talk about that, or would you like me to?
Well, CareerConnect, correct?
I'm sorry?
CareerConnect, that's what
Yes.
we're on. Yes.
Yep.
And I think, I believe our colleague Richard is here. I don't know, I saw his hand go up earlier.
Oh.
Well, while we're looking for that, I will talk about APH CareerConnect. And this is our site for people who may be looking for work or, currently employed, whether it's high school, looking for what's next after high school or transition programs, or if you're already in the workforce. So we have on the homepage of CareerConnect, we have, again, you'll see some similar themes here with our sites. We have our blogs. You can explore careers, find a job, succeed at work. We have resources for employers, for teachers, and professionals. We also have our some success stories and our directory of services. So a couple of highlights from CareerConnect are each month on the first Thursday of the month, we have a series called Career Conversations. And this is a 1-hour program where we spend about the first maybe 15 minutes kind of asking a guest some questions that we have prepared as team members. But then the remainder of the webinar is comprised of questions from the audience in Zoom. So people put their questions in chat and we answer those. And it really is an opportunity for people who are blind or low vision, who may be wondering, how does someone who is blind or low vision, we've had a lot of different professionals in different fields on the program. So we've recently had a mortician. We've had someone who works at NASA. Last month, we had Zelda Gephardt, who is low vision, talking about her journey in medical transcription and her experiences as she was losing vision on the job and she handled that. So again, it's just a wide range of professionals with sharing their experiences with Zoom, with the audience, and really enabling audience members to participate and conduct some of that informational interviewing techniques that are so valuable for people looking to enter the workforce. And then quarterly, we have a series also called College Conversations, and this is led by our student peer advisors for CareerConnect, many of whom are college students themselves. And so they host a webinar where they talk about their own personal experiences in college. How does one apply for financial aid? What are some things that I might want to consider if I'm going to college? How do I advocate for myself? How do I get the services and supports that I need when I go off to college? And do I want to attend a big school, small school? All of those questions. So it's really a peer-to-peer opportunity to connect with other students in college who are blind or low vision. We have the National Transition Conversation, which is for transition providers to really share what they're doing across the country, and for students who may be seeking those transition services, a great way to find out what is going on in that space. And again, as we talked about, we have our peer blogs and articles written by people who are blind or low vision, talking about their successes, talking about, what is it really like out there in the world of work. And we have advisory groups as well, which help us kind of, us in the right directions with all of our sites. We're very grateful for those who step up and help advise us. A little bit more. Go ahead, Melissa.
No, I was gonna say you're doing a great job. I'll sit back.
We have our new job seekers toolkit, and this is a great resource. It was a PDF for a long time, and we recently updated it to an accessible, self-paced, free online training course. So it's now online, interactive, and I apologize for the train in the background. There are 5 modules in this course, and they cover topics such as self-awareness, methods and resources, finding employment, the interview, and maintaining employment. So within the modules, you can take them, 1 through 5, or if you are maybe looking at going to a job interview, you could skip to the module that talks about preparing for an interview, for example. So again, it really is self-paced and learning at your own pace, and you don't have to sit down and take the modules 1 through 5. You can take them as you need or want. So that's a great resource. Again, it's all free. And thanks to our partners at Insight for helping us put that together. It's really been a huge success. And so we invite you to take a look at that. And a final piece of the CareerConnect family is our Transition Hub. And this is a place where you can go to find you can search for some questions that maybe have been asked about, transition. So if a student is in high school, what comes next? How do you take that next step after high school and move into maybe college, or maybe an apprenticeship or an internship? You can also search for programs that provide services for transition age youth. So if you are in one state in, maybe, for example, and you want to go somewhere else for some training, you can also look up what programs are available in another state and find those resources as well on our Transition Hub. And Melissa, would you like to talk about the press catalog?
Yeah, so the last 2 slides before our contact information are from APH Press or APH Press and Product. So our press catalog provides a catalog of every book that we publish. So you will find some things. There's a wonderful Babies and CBI book. There's all sorts of other resources and literature that you will find in the press catalog. And the next slide is the APH product catalog, which most of us are probably familiar with. So the various products, it is an extensive catalog that does take some time to get through. It is online as well, but it has everything from low vision to educational stuff to rec and leisure to physical activities. All sorts of things are available through the APH products catalog. And the last slide has our contact information. So Katie, myself, and Olaya, and who you can reach out to with further questions regarding the Connect Center and all of our offerings. And unless Katie has anything else to add, I cannot wait to hear from Michelle and all of her offerings with Fighting Blindness.
While we're prepping that, I do just want to say again, if you have questions, I know we covered a lot in a short amount of time. So if you do have questions, feel free to reach out to one of us, or again, you can always call or email our information line, and we are more than happy to assist you. So feel free to reach out. And I will pause and just give me a minute to get the next slide or the next presentation ready. While I'm doing that, Melissa, do we have anything in chat?
I don't see anything. I was just going to put our emails in the chat while you were doing that.
All right. Give me 1 second. Right. And Michelle, welcome. While I'm getting your presentation queued up, we're happy to have you with us today.
Thank you so much. Can you hear me okay?
Yes.
Okay. And just from a time standpoint, because I want to be cognizant, where are we at in our in our presentation
It is,
here?
it is 30 after.
Okay, perfect. Thank you. So while she's getting up my slides, I can just kind of get started. I'm Michelle Blaze, Director of Professional Outreach for the Foundation Fighting Blindness, and I was diagnosed with retinitis pigmentosa in 2004. I was approaching the age of 30. As probably many of you have experienced, it was a devastating and very frightening diagnosis. No one in my family had a condition like this, so I really was unsure about my future. I didn't know where to turn. I didn't know what resources were available to me. So it's really exciting to partner with APH ConnectCenter and to learn about all of the wonderful resources that you all offer right now to help those of us with low vision or blindness to maintain independence and to help with activities of daily living. So I'm delighted to be able to learn more about what all that you have to offer. And I'll be excited to share that with our constituency at the Foundation Fighting Blindness. The foundation is focused on research. So we really can bring to light the hope piece with all of this. So I'm going to be talking about who the Foundation Fighting Blindness is, some of the resources that we have available, including genetic testing, and then I'll provide a snapshot of some of the research that's underway. So if you want to go to the next slide, please. So the Foundation Fighting Blindness has been around for over 50 years. The mission of the organization is to drive research to find treatments and cures for blinding retinal diseases like retinitis pigmentosa, Stargardt disease, Usher syndrome, LCA, and even forms of dry age-related macular degeneration. Over the last 50 plus years, the foundation has become the largest private funder of retinal degenerative disease research in the world, and the organization has raised nearly $900 million towards the mission. The foundation funds a variety of different types of research, so all the way from projects in the lab to clinical trials. The foundation funds some natural history studies and then a no-cost genetic testing program, as well as a patient registry, which you'll hear about more in a few slides. Our goal with all of this is, as we are driving our mission, we want to be able to also provide the gifts of knowledge, community, and hope to patients and families, individuals and families, as they're going through their personal journeys with vision loss. Next slide, please. So the foundation has a variety of different channels to gather information, connect with others who have similar experiences, and also for that hope piece that I mentioned. I like to direct people first to our website, fightingblindness.org. On our site, you can find information about anything that I'm sharing today and then some. We have inspirational stories, information about genetic testing, information about the inherited retinal diseases, clinical research pipeline, all sorts of information, as well as how to get connected to local chapters and get involved with events, both in your local community as well on a national scale. The foundation does have a number that you can call in if you'd like more information, and perhaps, Melissa, you could type that into the chat for individuals that are interested in that. You can also utilize email info@fightingblindness.org to connect with the foundation if you'd like more information or to learn more about anything I share today. In terms of the community base, our chapter network is where you can find that. We have chapters in over 40 markets all over the United States. The chapters really serve as an opportunity and a place to connect with others, to get involved in your local community, to learn about local resources that are available, like APH ConnectCenter or any other support networks or services. So we really encourage people to try to find a local chapter. If there's not a local chapter through the foundation in your community, we are doing more and more web-based types of communications, so you certainly can get connected that way as well. The foundation hosts a variety of different events. Vision Walk is our flagship fundraiser. It goes on all over the US throughout the year. And it's a wonderful opportunity to get out and to help support the mission of the Foundation Fighting Blindness, and to help drive research. We have a variety of other events as well, again, web-based in your local community, and all of that information can be found out either on our website or through the local chapters. As I mentioned, the foundation does, a lot to share information about clinical research that's underway, as our mission is to drive that research. So we do host a number of webinars. We host presentations locally through the chapters. We do through our professional outreach team, which I lead. We do presentations to the eye care community and other professionals about research. And then we do also have a podcast called Eye on the Cure. A lot of the research updates are also available on our website. So if you go to fightingblindness.org and you select clinical trials, there's a pipeline. There are also articles and things that are published. So you can find out information about research through a variety of different ways. And then lastly, I would like to spend some time talking about our open access or My Retina Tracker program, which is our no-cost genetic testing and no-cost genetic counseling option. Next slide, please. So I want to start by just kind of highlighting and showcasing why it's important to get genetic testing as an individual with an inherited retinal disease. Number one, many of these diseases can look alike. I know for myself, when I was initially diagnosed, it was thought that I might have a cone rod dystrophy or even Stargardt disease. I have more central vision loss in the presentation. And so what genetic testing can do is really confirm that clinical diagnosis. One of our partners, Informs DNA, did a study, and they found that in as many as 13% of cases, a clinical diagnosis changed with genetic testing. So it is important to get that genetic test result. Genetic testing can also provide a more accurate prognosis for patients. It can also provide information about inheritance patterns and risk factors for family members. So through genetic testing, you can have a better understanding about what your inherited retinal disease is, how it might affect your children or siblings. And it just gives you a more holistic overview of what to anticipate with your IRD. There also is an FDA-approved gene therapy out there called Luxturna, as well as a multitude of clinical trials underway, most of which you would need genetic testing in order to qualify for, and I will be touching on those pieces later in the presentation. Next slide. So the Foundation Fighting Blindness offers a no-cost genetic testing and genetic counseling program. It's called the Open Access Program. And we partner with Blueprint Genetics and Informs DNA in order to provide this. Blueprint Genetics offers the My Retina Tracker panel. It is a 351 gene panel. It's very broad. That genetic test does have to be obtained through your eye care professional. So it does have to be physician ordered. Informs DNA provides no-cost genetic counseling. Informed DNA genetic counseling is offered through a telemedicine type of approach. So when you receive genetic testing, your physician can select Informs DNA for genetic counseling. Informs DNA will contact you and you will have a consultation in your home. It is a very thorough consultation. It usually lasts between 60 and 75 minutes. The genetic counselor goes through your family history, progression of disease. That counselor will also provide you information about your genetic test results. And he or she can also talk with you about clinical research clinical trials that may apply to you, or if you would qualify for Luxturna, they can talk to you about that as well. So it just this program really provides a holistic approach to genetic testing. It's about helping patients understand and manage their inherited retinal disease, and about getting patients on a path towards either clinical trials or treatment or cure. This program also helps the foundation continue to drive our mission to try to find treatments and cures and get FDA-approved therapies across the finish line. And the MyRetina Tracker Registry is a part of this program. It's also a standalone entity, and I'll dive deeper into that in just a second. Next slide, please. So in order to qualify for no-cost genetic testing or no-cost genetic counseling, I wanted to just highlight who this program is open to. So the genetic testing is open to all patients in the United States who have been clinically diagnosed with an inherited retinal disease. So RP, Stargardt disease, Usher syndrome, LCA, achromatopsia, choroideremia, any of the IRDs. If you have received genetic testing through another program and that panel included more than 32 genes, you would not qualify if that had been done within the last 3 years. So if you've had a test with more than 32 genes in the last 3 years, you would not qualify at this time for this no-cost option through the foundation. We have had more than 12,000 people receive genetic testing through this program since it was incepted in 2017. Again, this is a physician-ordered test. So you will need to go to your eye care professional, ask for the MyRetina Tracker panel. If your physician is unfamiliar with this program, I'm happy to help get information to your eye care professional. The foundation also has a list of physicians on our website, and any of those physicians can help provide the genetic testing. So if we can be a resource for you to find somebody to help get this test, we're here to help and are happy to do so. Patients are required to get genetic counseling if they obtain genetic testing through our program, and we do highly recommend that they participate in the MyRetina Tracker Registry. So let me take a minute to talk about the registry. And as I mentioned, the registry is part of the open access program, but it is optional. So this is a platform that's open to anyone who has been diagnosed with an inherited retinal disease. It's a global platform, so anywhere in the world, if you're living outside of the United States, you can still participate in the MyRetina Tracker Registry. This is free. It is a secure platform, and it is accessible to individuals with low vision or blindness. What the registry does is it serves as a bridge between patients with inherited retinal disease and the clinical research community. So it really bridges the gap between the two. In order to drive research, patients are needed for clinical trials. In order to find treatments and cures, we do have to have clinical trials. So the registry serves as a place through which biotech companies or researchers can find and identify patients for clinical trials. Now, the way that this works is we have a very small team of individuals at the Foundation Fighting Blindness who have access to this information. So if a biotech company or a researcher wants to potentially find candidates for clinical trials, they contact our small team at the foundation. Our team will do a query to identify patients that might qualify for that trial. And then our team contacts the patient or individual directly to provide information about that clinical research project. It is in the patient's hands or the individual's hands to then connect with that researcher or biotech company if they want to learn more or potentially participate in a clinical trial. So the registry serves as a way for biotech and pharmaceutical companies or researchers to identify and potentially recruit patients for those trials in a very confidential manner. We have had more than 24,000 people at this point register in the MyRetina Tracker Registry. And again, you can participate in this registry regardless of whether or not you have received genetic testing and regardless of whether or not you've received testing through our open access program. So if you have been diagnosed with an IRD, we do encourage you to create a record. The more information that you include in that record, the more valuable it becomes to both you and the research community. This registry does enable researchers to learn more about the inherited retinal diseases. So as you're creating a record, there are a number of questions, there are surveys, and we encourage you to include as much information in that record as you're comfortable including. Next slide, please. Oh, and you can go to myretinatracker.org for more information or to create a record, or you can contact coordinator at myretinatracker.org if you'd like some assistance. Just want to showcase how important we take patient privacy. Confidentiality is something that the Foundation Fighting Blindness and our partners take very seriously. So we do not ever share or disseminate patients' personal or individuals' personal information with third parties. If any information is shared, it is de-identified. So you can feel comfortable and confident that your demographic information and your personal information remains confidential when participating in both the registry and genetic testing through the foundation. Next slide, please. Okay, so now I want to shift gears just a little bit, and I want to give you just a snapshot of some of the clinical research that's underway. And this is just a snapshot. So if you'd like more information about anything that you hear, again, I highly encourage you to visit fightingblindness.org or listen in to Eye on the Cure podcast. There's a lot of great research going on, but just to give you some landscape, some background as we talk about some of these trials, the inherited retinal diseases are very rare. There are about 200,000 people in the United States who have an inherited retinal disease, about 4 million worldwide. Many of the inherited retinal diseases are identified in childhood, though there are those of us who learn about it later on in life, like myself. I was almost 30 when I learned about my inherited retinal disease. And the inherited retinal diseases are caused by a monogenic mutation, so mutations in one gene. There are about 270 genes, each of which, when mutated, can cause an inherited retinal disease. And again, some of the more common ones are retinitis pigmentosa, Leber congenital amaurosis or LCA, Usher syndrome, Stargardt disease, achromatopsia, choroideremia. So that's some landscape behind the inherited retinal diseases, and that's the focus of the research that I'll be highlighting today. Next slide, please. So the foundation supports a number of clinical trials and a lot of projects that are currently underway. There are over 40 clinical trials underway currently for the inherited retinal diseases, which is really remarkable. The foundation also has about 90 projects worldwide in the foundation portfolio. And I'm elated to say that the foundation has played a major role in about 88% of the clinical trials that are underway for the leading inherited retinal diseases. So the foundation is a big supporter of this clinical research and very involved in a variety of projects that are currently ongoing. Next slide, please. So I want to start by showcasing Luxturna, which is the first FDA-approved gene therapy for the eye or any inherited condition. Luxturna is a gene replacement therapy. So what that means is a viral capsule, a little small delivery system, is delivered into the retina through a subretinal injection, and that capsule contains a good copy of a gene. That good copy replaces the bad copy. Luxturna is for mutations in the gene RPE65, which typically causes LCA, but can also cause retinitis pigmentosa. The preclinical work that led to this FDA-approved therapy was done at Children's Hospital of Philadelphia, or CHOP, and the foundation supported that early research, donating about $10 million towards the research that ended up leading to this FDA-approved therapy, which was introduced to the market in late 2017. Spark Therapeutics is the company who who brought this to market, and Spark has now been bought by Roche Pharmaceuticals. This is a remarkable breakthrough for the retinal degenerative disease space. Children who received this therapy in clinical trials were reporting things like being able to see the faces of their loved ones for the first time, being able to see stars in the sky. Many of them were putting away their white canes, and some of the researchers that have been involved in this project have just been so excited about the transformation that this therapy has allowed for patients who have received it. And LUXTURNA has led to a lot of interest in our space, the retinal degenerative disease space. And part of the reason that there have been so many clinical trials that have surfaced and popped up. So if you want to go to the next slide, I just want to showcase a few of the current projects that are underway for other gene replacement therapies. And this slide is focused on mutations in the gene RPGR, which is a cause of X-linked retinitis pigmentosa. XLRP affects about 20,000 people in the United States and Europe. It is one of the leading causes of retinitis pigmentosa. There are 3 different companies that are currently have gene therapies in the clinic for X-linked retinitis pigmentosa caused by mutations in RPGR. 2 that I want to start with and highlight are AGTC and MiraGTX. These companies are both showing really promising results in their early research. These companies have trials that are either in or moving towards phase 3, which is the pivotal phase just before FDA approval. So we are rooting for both MiraGTX and AGTC, hopeful that one of these will cross the finish line and we'll have a second FDA-approved gene therapy. These are gene replacement therapies just like LUXTURNA. And so the AGTC and MiraGTX are delivering this gene therapy through a subretinal injection. Now, there is another company called 4D Molecular Therapeutics that's earlier in their clinical trial process. They're in phase 1-2. They're using an intravitreal injection, which is in the center of the eye, which is a little less invasive. We'll have to wait and see how that one moves along, but real promising research and exciting things ongoing currently for mutations in the gene RPGR causing X-linked RP. Next slide, please. So there are a number of different types of therapeutic modalities being studied. Gene replacement therapy is one of them, but there are many others. There are cell-based therapies, there are some gene editing strategies. And on this slide, I'm highlighting a couple of gene agnostic approaches. And what gene agnostic means is that this will apply to a multitude of individuals regardless of the gene that's mutated causing their inherited retinal disease. The first, and these are both neuroprotective strategies. So the aim or the goal of these 2 therapies is to really slow or stop the progression of disease. And the foundation is funding both of these projects. The first one is a company called Nacuity out of Dallas. They are looking at an oral antioxidant. It's a strong oral antioxidant called NACA. And they're focused currently on patients with Usher syndrome, which causes retinitis pigmentosa. The study has been done in Australia, but they're looking to move this into the United States. They are showing some promising signs, and things are moving forward nicely. So we're keeping our fingers crossed for Nacuity. The second company on this slide is Sparing Vision. Sparing Vision is a company that's based in France, and they're working on a gene therapy to slow or stop the progression of disease. This is a therapy that it's really kind of a novel, cool idea. So in our retinas, we have cells called photoreceptors, rods and cones, and those are the cells that enable us to see. What happens in people with retinitis pigmentosa is those rods and cones begin to die off. And what researchers have found is that as rods die off, cones are affected. And the reason is that there is a really symbiotic relationship between rods and cones. Rods actually emit a protein called rod-derived cone viability factor that helps protect cones. So rods give us our ability to see in light and dark. They give us our peripheral vision. Cones provide more central vision, color vision, our ability to see faces and see details. So as the rods begin to die off in diseases like retinitis pigmentosa, that rod-derived cone viability factor is affected, cones begin to die. What Sparing Vision is doing is they're utilizing a gene therapy to inject rod-derived cone viability factor into the retina, and the hope is that cones will then be protected and that central vision and or additional vision will be preserved to slow or stop the progression of disease. So this project is going to be moving along past phase 1-2, hopefully this year, and they are showing some really good, some great results in the research that they're doing. So 2 gene agnostic approaches being funded by the Foundation, Nacuity, and Sparing Vision. Next slide. Okay, so the last strategy or therapeutic modality I want to highlight today is optogenetics. Optogenetics is for individuals with advanced disease, and they're looking at retinitis pigmentosa and related conditions. So as I mentioned, we have photoreceptors in our eyes that enable us to see, and the gene therapies, the gene replacement therapies that I've talked about before are not going to be viable for people with advanced retinal degeneration. And the reason for that is when we have advanced disease, those photoreceptors are gone. So there's no cells to restore. What researchers are looking at with optogenetics is other cells in the retina, their support cells, namely ganglion or basal cells. And what they're doing is creating a strategy through which those cells act more like photoreceptors. So what they do is deliver a protein to those cells, bestowing light sensitivity. And the hope is that it will restore some vision. There are a few companies that are currently working on this type of modality, GenSight, BionicSight, Nanoscope, and Videri is working on some preclinical work. Some of the early research has shown things like individuals being able to see flashes of light when they hadn't seen light in some time, or being able to see high contrast movement. So really cool stuff. Still very, very early on in the clinical trial process. Some of these strategies do require patients to wear goggles in order to better transmit those visual stimulations or cues, but we'll have to wait and see where this goes, but a really innovative strategy through optogenetics. Next slide. Okay, so I just want to close things out just by sharing with all of you, and my friends at APH highlighted some of this. I think it's so important for those of us with low vision and blindness to be able to get ourselves on a path forward. And there are some steps that we encourage all of you to take just to make sure that you are getting all of the services and guidance that you need. Number one, connecting with groups like American Printing House ConnectCenter, the Foundation Fighting Blindness, and other support groups is really vitally important as you're going through your journey with vision loss. It's also important to confirm a clinical diagnosis through genetic testing. And again, the Foundation Fighting Blindness offers a no-cost genetic testing option. So if I can help you to learn more about that, please feel free to reach out to me. And genetic counseling is a very important piece of that. Number 3, it's important for you to receive medical care from an from an eye care professional who understands inherited retinal disease. They can help make sure that you have all of the testing done that you need. They can keep you informed of some of the research that's underway, and they can make sure that if you're having changes, they're putting you on a right path to get the care that you need with your inherited retinal disease or dry age-related macular degeneration. The foundation does have a list of providers on our website if you need to find somebody. We do hope that you will seek both low vision and rehabilitation services. Those services are so important for your activities of daily living. There are tons of devices, adaptations, just resources out there to help those of us with low vision or blindness, and those communities can help get you the items that you need. And last but certainly not least, obviously through all the research that I've presented today, there is a lot of reasons, many reasons to be hopeful and optimistic for the future. So keep that in mind as you are, going through your personal journey. And at the foundation, we can help keep you informed of all of that. So with that, I'm going to turn things back over to my friends at APH. If you need to contact me, my email address is mglaze@fightingblindness.org, and I'm happy to help or answer any questions that you may have. Thanks so much.
Michelle, this is Melissa, and we did have one question, so I didn't turn my video on so I can be able to read this. And for those of you who are wondering, the PowerPoints both will be available on APH's webinars page, as well as the recording will also, I believe, direct you to where you can find these PowerPoint presentations. But the question is that you had mentioned discussed common causes of retinal diseases, but I'm curious about genetic retinal diseases that was not mentioned. Do you have any information, resources, or can you point this person to someone for some resources with X-linked juvenile I feel like I'm going to slaughter that name. Diagnosis. Thank you. Yes, that, Michelle.
Yes, if you'll send me an email or email info@Fighting Blindness, yeah, we can get you directed one off on that, sure.
Wonderful. Thank you so much. And I know Katie put in the chat, but again, I cannot thank you for all of this information, and we will make sure you also have the links to share with everyone at Fighting Blindness. And thank everyone for your time this afternoon. I will go ahead and stop the recording. Thank you so much, Michelle.
Thank you. I appreciate the opportunity to join you. Everyone have a good day.